Please tell me about your educational background and professional experience.
Following my passion for patient care, I completed my Bachelor of Science in Nursing at the University of Advanced Medical Studies. During my degree, I undertook several clinical placements which solidified my interest in surgical settings, specifically finding the fast-paced environment and the opportunity to directly impact patient recovery incredibly rewarding. Upon graduation, I began my career as a registered nurse at City General Hospital within their surgical ward. Over the past 5 years, I have developed a robust skill set in pre- and post-operative patient care, wound management, medication administration, and patient education. I have experience caring for patients undergoing a wide range of surgical procedures, from elective surgeries to more complex trauma cases. I am proficient in monitoring vital signs, managing surgical drains, and recognizing and responding to post-operative complications. My experience has not only honed my clinical abilities but also strengthened my communication and teamwork skills within a multidisciplinary surgical team.
What are your thoughts on NHS values and hospital values?
I believe that the core values of the NHS, and indeed any hospital, are fundamental to providing exceptional patient care. Values such as compassion, respect, dignity, and a commitment to quality resonate deeply with my personal nursing philosophy. For me, these values are not just words on a page, but rather the guiding principles that shape every interaction I have with patients, their families, and my colleagues. In practice, this means always prioritizing patient needs and well-being, ensuring they feel heard and respected, and advocating for their best interests. It also means working collaboratively and respectfully within the team, contributing to a positive and supportive work environment where we can collectively deliver the highest standards of care. I am particularly drawn to the emphasis on "everyone matters," as I truly believe that every individual within the healthcare system, from patients to staff, deserves to be treated with dignity and receive the best possible experience.
Can you give me an example of when you demonstrated compassion?
Certainly, I recall caring for an elderly patient, Mr. Davis, following a hip replacement. He was understandably anxious and quite withdrawn post-surgery, expressing feelings of loneliness and frustration at his limited mobility. While ensuring his physical needs were met, I also recognized his emotional distress. During my breaks and whenever I had a moment beyond my immediate tasks, I would sit with Mr. Davis, engaging him in conversation about his life and his interests. I learned he was a keen gardener, so we talked about his garden and the flowers he loved to grow. I also involved the hospital's volunteer service to arrange for him to receive visits from a friendly volunteer. By taking the time to connect with him on a personal level and address his emotional needs alongside his physical recovery, I saw a noticeable improvement in his mood and engagement with his rehabilitation. He started participating more actively in his physiotherapy and expressed gratitude for the extra attention and care he received, demonstrating to me the profound impact of simple compassionate actions.
Describe a time when you delivered high-quality care to patients.
There was a particularly challenging case involving a young patient, Sarah, who was admitted with acute appendicitis requiring an emergency appendectomy. Following her surgery, Sarah developed a significant post-operative infection, leading to a prolonged hospital stay and considerable distress for both her and her family. To ensure Sarah received the highest quality of care, I proactively collaborated with the surgical team, the infection control nurse, and the physiotherapy team to develop a comprehensive and coordinated care plan. This involved meticulously managing her wound care, diligently administering her complex antibiotic regime, closely monitoring her vital signs for any deterioration, and providing consistent emotional support to Sarah and her worried parents. I also took the initiative to educate Sarah and her parents about the infection, the treatment plan, and what to expect during her recovery, empowering them to be active participants in her care. Through this proactive and collaborative approach, and by consistently advocating for Sarah's needs, we were able to effectively manage her infection, facilitate her recovery, and ensure she was discharged home in a stable and improved condition. This experience underscored the importance of holistic, patient-centered care and the power of teamwork in achieving positive patient outcomes.
What strategies do you use to prevent patient falls?
Patient falls are a serious concern in any hospital setting, and particularly within surgical wards where patients may be recovering from anesthesia or have altered mobility. My approach to fall prevention is multifaceted and begins with a thorough patient assessment upon admission, identifying individual risk factors such as age, mobility limitations, medication side effects, and cognitive status. Based on this assessment, I implement tailored preventative measures. This includes ensuring the patient's environment is safe, with clear pathways, appropriate lighting, and beds at the correct height. I always ensure call bells are within easy reach and patients understand how to use them. For patients at higher risk, I employ strategies such as regular mobility assessments, assistance with ambulation, use of mobility aids when appropriate, and bed alarms. Crucially, effective communication with patients and their families is paramount. I take the time to educate them about their fall risks, explain preventative strategies, and encourage them to actively participate in their safety by calling for assistance when needed. Regular patient rounding and proactively addressing any identified needs or concerns further contributes to a safe environment and minimizes the risk of falls.
What would you do if you found a patient unconscious?
If I were to find a patient unconscious, my immediate priority would be to ensure their safety and quickly assess the situation. Following the ABC approach, airway, breathing, circulation, would first check if the patient has a clear airway and is breathing effectively. I would then check for a pulse to assess circulation. Simultaneously, I would immediately press the emergency call button and call for urgent assistance, clearly stating the patient's location and condition. While waiting for help to arrive, I would continue to monitor the patient's vital signs, including respiratory rate, pulse, and blood pressure if possible, and be prepared to initiate basic life support if breathing or circulation is absent. It is also important to ensure the patient is in a safe position to prevent further injury. I would gather any available information about the patient's medical history, medications, and recent events to relay to the medical team upon their arrival to facilitate prompt diagnosis and intervention. Clear and concise communication is essential in such emergency situations to ensure a rapid and effective response.
How do you resolve conflicts at work?
Conflict, while sometimes challenging, can be constructively resolved through open communication and a professional approach. If a conflict were to arise with a colleague, my first step would be to address it directly and privately with the individual involved, aiming to understand their perspective and explain my own in a calm and respectful manner. Active listening is crucial in this process. I would strive to truly hear and understand their concerns. I believe in focusing on the issue at hand, rather than personalizing the disagreement, and seeking to find common ground and a mutually agreeable solution. If a direct conversation does not fully resolve the issue, or if it involves a more complex situation, I would then seek guidance from my nurse in charge or a senior colleague to mediate and facilitate a resolution. Maintaining professionalism, empathy, and a commitment to finding a positive outcome for all involved is key to effective conflict resolution and maintaining a harmonious working environment.
How would you manage a patient with cognitive impairment?
Managing a patient with cognitive impairment requires a patient-centered and adaptable approach, prioritizing their safety, comfort, and dignity. Firstly, it's vital to establish clear and simplified communication, using short sentences, speaking slowly and clearly, and utilizing nonverbal cues such as gestures and visual aids where appropriate. Creating a calm and predictable environment can be beneficial to reduce anxiety and confusion. Maintaining a consistent routine, involving familiar caregivers or family members if possible, and orienting the patient regularly to time and place can help provide reassurance and reduce disorientation. Safety is paramount, so ensuring a safe environment, particularly in relation to mobility in preventing falls, is crucial. I would frequently monitor the patient, anticipate their needs, and be prepared to manage any agitation or distress with patience and de-escalation techniques. It's also important to collaborate closely with the multidisciplinary team, including physicians, therapists, and family, to develop a holistic care plan that addresses the patient's individual needs and maximizes their well-being and quality of life, recognizing that their cognitive impairment impacts all aspects of their care and experience.